Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about hand rejuvenation. Hand rejuvenation is often a question I get from patients as I'm leaving the room and they say, "Oh, but doctor, what about my hands?" It's usually from women over 40, and as we all get older, we lose volume in our hands and they become what we would call skeletized, which sounds as awful as it is, meaning that you can see the bones and the tendons underneath the skin, and that makes the hands look much older than they are. Additionally, people often do not take good care of their hands. They forget about their hands when it comes to sun exposure and skin products, and they get a lot of sun damage and brown spots on the backs of the hands, which also makes them look older. So today I'm going to talk about how to improve the appearance of aging hands. First, let's tackle the loss of volume. As we get older, we lose fat in some areas and gain it in others. The hands is a place where the fat is lost. So how do we replenish it? Well, you can do fat injections. I do not perform this procedure, but it's a good option if you don't mind a minor surgical procedure. Often plastic surgeons perform this. Sometimes a dermatologist can also do it. It's often called fat transfer. And fat is taken from the buttocks or the stomach and then spun down and injected into the backs of the hands. The upside of this procedure is that it's your own fat. And sometimes people get very excited about removing fat from the buttocks, but the truth be told, it's not enough of the fat to make any difference in the buttocks. Another upside is that fat transfer can last for 10 years or longer, but on occasion, it barely lasts at all. And between the variability of it and the minor surgical procedure are the two downsides of this option, which leads me to what is more commonly done, which is fillers. As a dermatologist, I routinely inject fillers into the backs of people's hands. This can be done easily, on demand, any day of the week in a quick office visit. The upside is that it's very easy to do. In addition, it's fairly predictable and that it lasts up to a year or so, depending on the filler. The downside is that it does not last forever, so it does need to be repeated over time, and it can cause bruising and occasionally aching of the hands, but those side effects tend to go away in a few days to a few weeks. In the office, if I'm going to do this procedure, I often use Restylane Lift as my choice of fillers since it is FDA approved for this area, but there are many hyaluronic acid fillers that will work well here. Some doctors like to use Radiesse for this area, and that's fine, it works well. I just tend to stay away from that filler as it's a bony substance, and if somebody gets a bump from it, which is rare, but it does happen, it is very difficult to remove. I prefer to always use hyaluronic acid fillers because if there is a bump, which is uncommon but happens occasionally, I can inject an enzyme and the bump goes away fairly easily. I will often recommend numbing cream in advance on the backs of the hands to help take the edge off of discomfort of the injections, but it's really not that bad. It's pretty mild discomfort. After I inject the filler, I will massage it, and then a little trick that I learned many years ago, I do not even remember who taught me this, but I put a clean gauze on top of the patient's hand and I have them sit on their hand while I do the other side. And then I have them sit on both hands for a few minutes before leaving the office. The pressure helps spread out the filler nicely and evenly, and I've never had a patient have a bump on the backs of the hands from their filler injections. Fillers work really well to replenish the volume, and then we just repeat as necessary. I'd say on average, I will start with 2 syringes of filler, 1 for each side, and then just repeat with 1 every year for maintenance. It depends. It depends on the patient and how much they need, but I would say fillers for hand rejuvenation are pretty easy and they work really well. Moving on to reversing the brown spots. The brown spots are often lentigos, which is a fancy term for basically sun damage, but sometimes they are seborrheic keratoses, which are a thicker growth on the backs of the hands. They are benign, but they're a little bit more difficult to get rid of. So I will often recommend cryotherapy, which is also just called freezing the spots, and it's low tech, but it's often very effective and it's not that expensive. I will tell patients to wait for the winter or when they have no big events because it's going to look worse before it looks better for a number of weeks. The cryotherapy will cause mild irritation and it is mildly uncomfortable, but I don't usually recommend numbing cream for this procedure, but it's fine to do if the patient is worried about discomfort. Sometimes we need to do the cryotherapy more than once, and I will book 2 sessions around a month or so apart. The downside of cryotherapy is that there is a risk of leaving a white spot instead of the brown spot, and to avoid this, I really try very hard not to overdo it. And I always bring patients back for a second treatment if needed. I'd rather undertreat and need to do it a second time as opposed to being really aggressive and leaving white marks. The second choice for brown spots is laser, and there are many lasers to remove brown spots. I will often use in my office either my GMP, otherwise known as the Gentle Max Pro from Candela, that has good settings for this, or I will use my V-Beam Perfecta, also from Candela, which has good settings for brown spots. And the result is often similar to cryotherapy, so it really depends on the person, their budget, which modality we choose. And also, the lasers really work best for the lentigos and not so much the seborrheic keratoses, so it also depends on what's causing the brown spots. There are other lasers that I can use, such as Fraxel or Clear and Brilliant, and I will do those on the hands, and that helps to fade the brown, generally speaking, but it doesn't really remove particular spots. So I will often start with targeted lasers or cryotherapy for the brown spots, and then for general resurfacing and maintenance, we could do the Fraxel or the Clear and Brilliant. Also, brief mention for chemical peels, which is another option. Again, less expensive, a little lower tech, but works well as an alternative to the Fraxel or the Clear and Brilliant as a general fading of brown spots. Lastly, about the hands, I'd like to remind listeners that sunblock is key. The sun just degrades collagen, and that thins the skin, making the volume loss worse. And the sun also causes brown spots, so it's best to avoid the sun on the backs of the hands and everywhere, of course, if possible. I will often recommend gloves for golfers, or also people can wear driving gloves, since the UVA rays come right through the car windshield and can cause pigmentation of the skin. Personally, I just use sunblock on the backs of my hands all the time, but there are many people who just do not like the feeling of sunblock, so gloves with SPF in the fabric or just regular gloves to block light are another alternative. A reminder that sunblock only lasts 1 to 2 hours, needs to be reapplied, of course. So in summary, the issues of aging hands are twofold: volume loss and brown spots. We fix the volume loss with fillers, and we fix the brown spots with cryotherapy or laser treatments and occasionally chemical peels. Sunblock is best to help prevent the aging of the hands. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.